Hi, everyone, and good afternoon. Welcome to the Accreditation and Certification Huddle series that we've been hosting every Wednesday afternoon at 2 p.m. Central, 1 p.m. Mountain. Today, we will be discussing survey readiness during COVID-19. My name is Nancy McDonald, and I will be your facilitator today. I'm a quality improvement advisor in the Great Plains area, specifically in South Dakota. My colleague, Allison Bruner, will be serving as our chat monitor today. So we strongly encourage you to not be shy and to use the chat function if you have any questions or would like to share anything with the group today. This huddle series has been created as part of the Partnership to Advance Tribal Health, better known as PATH, which serves the Indian Health Service hospitals across the country. We'd like to start off today by asking you to please type in your name and facility in chat. All right, next slide, please. So the overarching objectives of the Huddle series are to learn to apply new techniques and tools to use with accreditation, and then improve overall accreditation knowledge and to improve overall PCMH, patient-centered medical home knowledge. All right, next slide, please. Today's session is lucky number 7 of 8 sessions in the Huddle series. So thanks again for joining us today. We hope to see you again next Wednesday at 2 p.m. Central, 1 Mountain, for our final session, which will focus on the National Patient Safety Goals. So if by chance you missed a session, that's not a problem. The session materials and recordings will be available on the PATH website at www.comagine.org. You can click on Programs, Partnership to Advance Tribal Health, and then Events. That's where you will see both the Huddle recordings and the monthly Learning in Action Network recordings. So the reason we bring these series to you is to assist your team or teams in obtaining proper resources and tools to be successful in your accreditation journey for your facilities. They're designed to promote networking and sharing experiences, like an all teach, all learn type of thing. Our goal is to ensure that your teams have the resources and tools you need to perform the best that you can. So your PATH quality improvement advisors and the rest of the PATH team are here to support your teams the best that we can. Next slide, please. So today's session, we plan to address a follow-up request from our previous huddle and then move on into our agenda. Today's topic was actually decided upon by our participants from a previous huddle. So our objectives today are to understand survey readiness during COVID-19, to discuss hot topic items during surveys, including the new Information Management Joint Commission standard, as well as to learn how to use the Joint Commission Connect page to validate a survey. We will share all resources and tools that we discussed today in chat. Allison will be plopping those in as we talk about them into chat, but again, the recording and all the information, resources, and tools will also be available on the comagine.org website, like I just mentioned on the previous slide. So lastly, we'll have time for some open discussion, not only at the end of our time together, but kind of weaved in and out throughout the slide deck. We're hoping for some open, candid conversations from all those participants that are on with us today. So it's always fun to engage and hear from others on what's new, what's working, and what to expect. That's how I always learned best, is just hearing from others who had been through something. And so we hope to bring a little bit of that to you today. If there's an acronym that we have not expanded upon that you don't understand, please don't hesitate to ask us to expand upon that. We try to make sure that we have all those explained for us. So we will go ahead and get started. Next slide, please. So first off, we'd like to be responsive to your requests. So here's a follow-up from last week's session where there was a request for some sample personnel file documentation, I believe. So our PATH Quality Improvement Advisor, Carmen Alexander, will provide a follow-up on this for us. So Carmen, you want to take this slide away from me?
Sure thing. And just as a quick recap, yes, this is follow-up from our survey documentation session. And we had talked about personnel files. The hospital that created this was transitioning actually from Joint Commission to HHC. So trying to figure out some new standards and then prep for both the area mock and the upcoming accreditation survey. And based on previous experience with surveys, decided that it would be pretty important to review the personnel files prior to the mock. And as you can probably guess, many of the files were organized differently. It was hard to locate information, quite a bit of extraneous information, sometimes decades of information. So very difficult for both the team doing the gap assessment and a potential surveyor to go through. So the decision was made to take the format of the credential files, which were very easy to work with, and layer on, in this case, the HHC accreditation requirements. So together we created a format that addressed all the HHC requirements in order. As you can see, we created some instructions to make it easier for the supervisors who had to put these together, and then ordered the materials, trained everybody, and had them work through it. So it did work very well. We haven't had the real survey yet, so the facility's sort of waiting to see how that goes, but certainly it helped create a more organized way to assess gaps and just have a standardized process. We did have a couple of learnings from that. In hindsight, potentially would have created different file cover colors for physicians and for contractors. While almost everybody liked the structure of the file, as you can see, it's not a 3-ring binder or anything like that. A few people did say they felt it was difficult to, take things in and put things back in and take things out. But overall, at this point, the facility is feeling that that was a good way to go. So again, based on past requests, we did decide to provide pictures of this. We thought this was the best way to do it, but if anybody would like any additional information or maybe some of the documents, we can certainly provide those as well.
That's great. Thanks, Carmen. Can we attach those resources, Becky, to the presentation and recording out on the Comadge website for today?
Yes, we definitely can.
Awesome. Thank you. All right, next slide, please. We can jump into survey readiness during COVID-19. The Joint Commission has provided a few updates regarding Joint Commission surveys during COVID-19. And the first is that surveys are now on site and, of course, unannounced. Second is that the initial surveys and the past due surveys are being prioritized, but that we can expect delays. But we do talk a little bit about this in a few slides down the way, that teams are able to monitor the notification of scheduled events sections on the Joint Commission Connect page to know when to expect surveyors. Kind of like I said, we'll review that in just a few slides, but most importantly, know to expect delays when waiting for a survey. Lastly, the surveyors will be following the facility's infection prevention and control policies, especially related to COVID and testing. You will want to make sure that your staff know and understand your COVID policies and your infection control policies. Also make sure that when your surveyors arrive on site, that they're screened appropriately when they arrive on site. So one of the questions that we had in our discussion and prep for this presentation today was that if the certification is due in January and an accreditation team is not showing up, do we need to file for an extension? So Carmen, do you want to talk a little bit about that?
Yes, so what we are understanding at this point in time is that there is a 2-month window that Joint Commission does provide. So there's a little bit of a grace period in case there are issues with the hospital. And that does require a process. However, at least what is being communicated at this point in time is that if Joint Commission or another accrediting agency is delayed due to catching them up after COVID, there is not anything that the hospitals need to do. So there will not be, maybe a risk of losing the accreditation because the surveyor is not able to get there in time.
Great. Thanks, Carmen, for that clarification. All right, moving on to the next slide, please. The Joint Commission, again, like I said, has provided some guidelines on what to expect for changes during COVID, and we've included 7 that we're aware of. So the first one is that the number of people in your group sessions, this will depend on the facility guidelines on what you currently have in your policies and protocols, but they may have their own survey team, and they may have their own guidelines that they want to follow. So the use of audio or video conferencing to meet your team composition is allowed in these instances. So we want to be sure that we're prepared and able to meet the requests of the survey team in order to ensure that you have the team that you need available. Number 2 is that the surveyors will wear a mask. So they will more than likely have their own. If not, make sure that you have those at your entry where they would be entering your facility. Number 3 is the use of screen sharing. Instead of sitting directly next to somebody to observe documentation or RPMS, staff will need to be able to manipulate, not necessarily give them control, but there will need to be screen sharing. So I just may have some restriction on this. And so if anybody's been through this or has had a surveyor and they've had to do this, we'd like you to speak up or type something into chat, but make sure to include your IT as needed to make sure that you're meeting the needs of those surveyor requests. Has anyone had an experience recently where they've have or have not followed this guideline? Okay, moving on to number 4 is to allow for social distancing. Surveyors may request. Yeah.
Alyssa commented in chat, our survey took place in a conference room using a large screen to display the chart.
Perfect. So that's exactly what we're hearing. So then did the staff then need to manipulate that for the surveyor? Yes. Okay, great. Thank you for sharing. Number 4 is to allow for social distancing. Surveyors may request to interview patients or your staff via telephone or other avenues rather than in person. So ensure that you have proper access available for alternate interview capabilities. Has anybody experienced anything from some surveyors related to that? Keeping the room size small? All right, we'll move on to number 5. Surveyors will not enter your COVID confirmed room, so that's a good thing. But if a facility has an entire wing or entire COVID floor designated, they may actually want to enter the sub rooms for those just to ensure the capabilities of the negative pressures for those rooms. So they may ask to see that. Has anyone experienced that?
Nancy, Alyssa commented in chat again, yes, our conference rooms indicate the number of people allowed in the rooms. The surveyors did ask to come to the inpatient to observe.
They did not enter the sub room, I see, Alyssa, thank you. All right. Okay, good to know. Thank you for sharing again. Number 6 is social distancing will be a rule of thumb probably for the foreseeable future. And so just to be aware of the social distancing guidelines, again, 6 feet apart, the number of people in the room. And then number 7 also deals with, similar to that, limiting the number of people in group sessions, social distancing, is to also limit your observers, such as your scribes or students or anyone else that you may have in a large group setting. So if anyone else has had a recent survey and they have asked for limitations in the group, we would love to hear what you're experiencing. All right. Well, I think the key to take away from these guidelines that we are aware of is just to make sure that your staff are aware of these, at least these key topics. Here are a few hot topic items that may not really come as a surprise to those of you who are on the line. First is that during the pandemic, the Joint Commission has been focusing on the impact of the pandemic and your facility's ability to respond to that, as well as your infection control and emergency management programs. This will also be true on your PCMH surveys as well. So make sure that your policies are up to date and that your staff feel comfortable speaking about them. Natasha was not able to be on the call with us today, but she did want me to make sure that I mentioned that this is indeed true also for your PCMH surveys, and that they will focus on your infection control policies, hand hygiene, and basic infection control monitoring. So I have a document that Allison shared in our chat, and this is the COVID readiness assessment that most of the facilities did several months ago. Whether you completed it with PATH or not, ensure that you have the information in your processes documented and ready to go, and that your staff are, again, aware of this readiness assessment. So if you're unfamiliar of this assessment, please click on the link and talk to your leadership team to ensure that you know how your facility handled all of the guidelines on that document. So one of the questions we had in this slide was, what are you doing in your facilities to ensure that your staff are aware of your infection control policies? Are you having meetings? Do they have to sign off on the fact that they reviewed your policy? Are you assigning them the review in policy stat? How are you monitoring that? Anyone brave enough to talk?
Can you hear me?
Yes.
This is Alicia. So before our Joint Commission survey and kind of throughout COVID, we had hospital-wide Skype calls at least once a month for any changes, and if anything happened in between, that was disseminated to all of the managers so they could roll that out Emails were also sent out, and then just prior to Joint Commission, we also did tracers just to follow up to see that they understood the information that was disseminated and how they would answer the questions.
Very nice. Thank you, Alicia.
Sure.
I see a response from Dr. Garazas from our Pine Ridge facility. So thank you for responding on that our staff have to do an in-house CME about infection, and they have regular infection control nurse visits around the facility. Jimmy's been busy down in Pine Ridge. Thank you for sharing. All right, so let's move on to the next slide, Jonathan. So here's a new standard that is effective May 1st of this year, and it's on information management. Allison will insert the link also in chat for you to access this standard. This standard is that the hospital needs to meet requirements for electronic exchange of patient health information. So there are 5 elements of performance that I will review, and then we'll call on one of our path partners to help share a recent finding or an example of this if they're willing to share. So I have summarized these elements of performance on the screen for you. These are not the full element performance. You can see that on the link that Allison has included in our chat. But the first element of performance is that the facility has a fully operational notification capacity within their electronic health records. The second element of performance is that notification includes the patient's name, the treating practitioner, and the sending institution's name. Number 3 is that the notifications are sent at the time of the patient's ED registration or inpatient admission. Number 4 is that the notifications are sent either immediately prior to or at the time of the patient's discharge or transfer from the hospital's emergency department or inpatient services. And number 5 is that there's confirmation that its electronic medical record system sends the notifications to post-acute care service providers and suppliers who need to receive notification of the patient's status for treatment, care coordination, or quality improvement purposes.
Yeah, Nancy, this is Jimmy from Oklahoma. And I just want to point out that this standard went into effect May 1st. So know that it can be asked on your survey, and it has been asked on surveys already. So to prepare, it would be a good idea to get with your IT or your CACs to discuss the processes that's already in place to send the notifications that go to other providers and other caregivers for that interoperability. And these are related to the ADT event notification. So be able to speak to that process if you have a surveyor ask you, and then have some type of written documentation that refers to the process. Maybe possibly have screenshots or reports from the EHR, and this is just to help support your process of that new rule. So I'm not sure if there's anybody else on the line that have this asked during their survey, but that would be great if you could just kind of add to any experiences that you've had.
Thanks, Jimmy, for sharing that. Yeah, if there's anyone that wants to come off mute and talk about this, that'd be great, or to type something in chat. While we're waiting for that, IHS does have their own HIE from preparation of this presentation with my colleague Natasha Green. She said that HIE only connects internally. Is that correct? It doesn't connect to outside organizations yet?
That's my understanding, Nancy.
Okay. She did say that the direct secure messaging that you have available to you will meet this standard if it is appropriately used for all encounters. And then if your facility is part of a state health information exchange, you are covered for all of these. If you are submitting data to the HIE, you are covered and meet this interoperability standard. Anyone have any questions, concerns, comments, sharing of experience on this?
Is there any more details or information regarding how the direct messaging is meeting this interoperability rule?
The only thing that when we were preparing for this is that it needs to make sure that it is on, like the element of performance states, is that the notifications need to be at the time of the patient's ED registration or inpatient admission, and at either immediately prior to or at the time of the patient's discharge or transfer from the hospital's ED or inpatient services. So from how I understand it, the direct secure messaging is more of a manual process. Is that correct, Alicia? Is that how you understand it?
Yes, that's how I understand it, but we were given notification from OIT to use iCare.
Okay.
And so this one's new, the direct messaging. That's why I was curious if maybe there was another way. I know we've been using the directive that was sent down from OIT for case managers who deal with the discharges, and the numbers are minimal in that area for our hospital, but it's more of the ER requirements that we're struggling with. And so if there's something beyond iCare and the use of direct messaging and there's more information, it'd be nice to know a little more detail about that.
So maybe that's something we can investigate and bring back to our final huddle next week.
Thank you.
You bet.
Hi, this is Jennifer. I just had some questions. I'm from Galpin Medical Center in New Mexico. We just had our Joint Commission consultant here, and we should have had her review this EP in our hospital, because I'm like a lot of people, I'm trying to figure out how we meet this standard. And I know you mentioned that there were some hospitals out there that actually has gone through a survey and they have been surveyed to this already. And I would love to know the correct answers on this, because it'd be interesting trying to piece together what we use here as far as our EHR and in meeting this and how they got around that. So I don't know if any of those people are on this call, but I would really like to know more about this one and how IHS met that.
All learn from one another.
Nancy, this is Sarah Leek. I'm with PATH, but I don't know if this is something that I would think it would be addressed in the meetings. I think Susie Postal has meetings on MACRA and promoting interoperability. So I'm happy to send an email to her to see what information she has as far as this system and how that might support this. If there still is question, or if there's anybody on the line that knows that answer or is on those calls.
Well, and interestingly enough, I have a call at 3 o'clock today with Matthew Ellis, and we are talking about some iCare panels. So I will also mention this to him, and we will make sure that we have a follow-up for you next week.
Thank you.
You bet. So Sarah, if you still can reach out as well, I'll mark you down as a to-do.
Sounds great. Thank you.
Thank you very much. All right, well, I see we're running short on time, so I will zoom through these next two slides pretty quick. Jonathan, next slide, please. The Joint Commission Connect provides a lot of resources, one of which is the opportunity for facilities to check to validate a survey. Some may be able to find out about a survey prior to the surveyor showing up on site if they check early enough. The Joint Commission customers can now access a new mobile-friendly version of the notification of scheduled events, including a notice of the on-site survey or review that can be accessed via smartphone. So if you receive notification of events for more than one organization, notifications will only be displayed for those organizations that have scheduled events. If no events are scheduled for any of the organizations, the message will indicate that there's no scheduled events. And this can be very helpful when you're waiting for your surveyors. I actually do not have a login for this, so I couldn't actually play around with this. Allison will drop the link to be able to access this Joint Commission Connect into our chat. So I'm assuming this is probably not a new resource for most of you on the line. Anybody willing to come off mute and or type in that yes, they do use this Joint Commission Connect tool?
All the time.
Oh.
We do too here.
Thank you. All right, next slide, please, Jonathan. I thought this one was a great tool as well. This one is, I can't even tell you what the site of it, QCore homepage. Allison's gonna drop the link into that as well. This was a great resource. I could get into this one. It shows all sorts of reports that you can pull, including the top 25 citations. You can funnel by a state, you can funnel by region. So you can look at the, again, overdue recertifications, deficiency counts, all sorts of citation frequency reports. All of these can help guide your focus as a facility to prepare for your upcoming surveys. So if you're not familiar with this one, play around with this one. This one is awesome. Is this also a tool? Crystal, I'm going to pick on you, or Alicia, do you guys use this one as well?
I haven't seen this one before,
Yeah.
but I appreciate you sharing it.
Yeah, this one was really nice. Of course, it's, you know, we'll tell you they're focusing on infection control policies, but so you can see the actual tags and what hospitals are getting cited for. So fun one on that. With that being said, that is all I have. I see there's a couple, is there some questions in chat? Allison, do I see one on a?
One from Kimberly Jones that says, does anyone have a resource for HHC tracer activities?
Kimberly, this is Nancy. I am not a HHC subject matter expert, but is there anyone else on the line that Partnership to Advance Tribal Health or others that could point Kimberly in the right direction?
This is Carmen. I can say we've been through with a couple of facilities the HHC materials, and it is quite different if you're accustomed to Joint Commission. So they do not provide anything like that. They do provide quite a few worksheets, but not the tracers in the terms that you're used to. That is a question that one of the hospitals also has lined up for one of their Q&A sessions. So if we do get an answer on that, we can provide it back both personally and in this forum.
Great. Thanks, Carmen. You can go to the next slide, please, Jonathan. So we are at our time for some questions and answers. Anyone have any questions on our presentation today? We will move into our open office hours here in just a few minutes. So Jonathan, you want to go to the next slide, please? So before we move into our open office hours, we would like you to complete a really brief Survey Monkey. We do our best to incorporate your feedback into bringing beneficial and learning activities to you in the future. So if you could please take the time to click on the link that Allison just plopped into chat. We appreciate hearing from you. And our next huddle is our last accreditation certification in PCMH huddle. It is on the National Patient Safety Goals. We had a dry run for it today. It's has a lot of great content and information in it. So I'd encourage you to join that with us next week. And also we'll promise to bring back some more information for you on the questions that were asked during our call today. Next slide, please. So here are the resources that we used today to pull our information together for the for our slide deck. And with that, Jonathan, if you want to move to the next slide, we can now start our open office time where we can talk and share openly. And if we don't have a question, an answer to your question today, we'll make sure to get it off to you next week in our final huddle. If anybody has any questions, you can either type them into chat or you can come off mute and ask, and we'll make sure to try to find a resource or a tool for you. Is there anyone on the line that uses those iCare for iCare panels for meeting this new standard?
This is Alicia. We did start it here just with our case managers for now, and they find it, relatively simple to use. It only takes a couple minutes, but it's more of, like I mentioned, the ER area where we're struggling with the larger volumes and trying to determine which one of those individuals require a follow-up. But we're using it and it seems to be working well for discharges.
Sounds good, thank you.
This is Audrey here at Fort Belknap. I don't use it for this standard, but I do use iCare because I track like a lot of stuff for COVID. iCare is it is pretty user friendly once you build your panel, and there are usually like your diabetes area nurse probably has all of the go-bys that you could email her and ask how to build those specific panels, and so you can be monitoring certain patients.
Great, thanks for sharing, Audrey. The discussion I'm having today with Matthew Ellis is on the iCare panels for NHSN reporting. So be looking for information coming on that from Matthew, I think sometime in August. Any other questions? Ella, yes, the training materials are available. They will be all the recording and the materials for This session and previous sessions are available at www.comagine.org. I'll type it into chat. And then click on projects, partnership to advance tribal health, and then events. And that's where you'll see all those recordings for our huddle series and the monthly learning and action networks. You're welcome. Okay, well, I will give you back a few minutes in your day. Everybody have a good rest of your week. Bye.